my name's Natasha. I'm going to be starting an assessment on you, cardiovascular, your peripheral vascular, abdominal, and respiratory. Do I have permission to record you for my class?
Yes.
Okay. I'm going to perform hand hygiene right now. I'm going to start with the respiratory exam. I'm going to assess the rate of breathing and your effort. The rate of breathing looks like she's not having any effort to breathe, no accessory muscles. The rate is normal. No signs of cyanosis on her fingers or her lips. So I'm gonna look at the shape of her chest, looking for for symmetry. Looking at the front and the sides, the ratio is 1:2, which is perfect. So now I'm going to palpate your chest wall, checking for tactile and firmness. So when I place my hand on your back, can you say 99?
99.
Any pain?
No.
All right. No tenderness and firmness is equal bilaterally. So I'm going to trust the chest expansion. I'm going to go behind the patient and hold the bottom of her back. Can you breathe in and out? Okay. Chest expansion is symmetric. So now I'm going to percuss your chest looking for resonance. I'm percussing. Okay, all set with that. So resonance sounds are noted throughout. So now I'm going to percuss for a diaphragmatic excursion. Take a deep breath in and out, and then hold. So this is where I hear the sound change. I'm going to do it one more time. Take a breath in and out, hold. So if I had a ruler, it would have been 4 centimeters, which is normal. So now I'm going to listen to your lung sounds. Can you breathe in and out of your mouth? I'm doing this posteriorly and laterally, and now I'm going to do it interiorly. So I hear clear breath sounds, no adventition sounds noted. So now I'm going to do voice transmission. I want you to say E while I listen to your lungs.
E.
Mm-hmm. E. Mm-hmm. E. Mm-hmm. E. Mm-hmm. E. Mm-hmm. E. Perfect. So it's muffled E sound, which is normal. Can you whisper 1, 2, 3 while I listen to your lungs?
1, 2, 3. 1, 2, 3.
Perfect. So the whisper sounds are faint, which is expected, so that's good. So that completes the thoracic assessment. So now I'm going to do the peripheral vascular assessment. So I'm going to palpate your pulses and your lymph nodes. So I'm going to do the upper extremities. I'm going to do the radial and the brachial pulses. You see this one? Both pulses are strong equally and bilaterally. So now the epitrochlear nodes, I'm going to do the inner and the elbow, the inner side of the elbow. No lymphadenopathy noted. So I'm going to do your axillary lymph nodes in your armpit. I'm going to lift up here and feel. Any tenderness?
No.
No palpable nodes or tenderness. So I'm going to do the lower, I'm going to look at your lower extremities looking for swelling or discoloration. There's no swelling or discoloration noted. So I'm going to palpate your femoral arteries near your groin and upper thigh. Any pain?
No.
The popliteal, which is behind your near knee. Dorsalis pedis, I'm going to palpate by the artery on top of the foot. So the posterior pulse and the inner ankle I'm palpating now. Okay. All pulses are present and equal. The temperature of your legs are nice and warm and they're symmetric. Also, I'm going to look at peripheral edema. I'm pressing the shins of your ankle. There is no edema noted bilaterally. So lastly, I'm going to do the Allen perfusion test. I want you to put your hand in a fist. I'm going to occlude one side. Open. Colors going back, perfect. Let me do the other hand. Fist. Open, color coming back, perfect. So the next one is the cardiac exam. Can you lay your head up, Mom? I'm gonna inspect your neck veins and carotid pulses. So there's no exaggerated neck veins, so her jugular venous pressure is normal. I'm going to listen to your carotid arteries with my scope of the baldoscope. I'm listening at the angle of the jaw, the mid-cervical, and the base of the neck. No brutes noted. I'm going to palpate your anterior chest for lifts, heaves, or thrills. None present. So now I'm going to locate the maximal pulsive impulse. So this is at the 5th intercostal space at the mid-clavicle line. Okay. As I palpate, I notice it's 2 centimeters in size, which is normal. So now I'm going to listen to your heart sounds using the diaphragm and stethoscope. So I'm going to do the aortic air in the right intercostal space. Pulmonic area in the left intercostal space. Erb's point, the left 3rd intercostal space. Tricuspid in the left 4th intercostal space. Mitral in the 5th intercostal space. So I'm going to repeat that, but use the bell side. So the right 2nd intercostal space of the aorta. Pulmonic of the 2nd left intercostal space. The Erb's point at the 3rd intercostal space. The tricuspid in the 4th left intercostal space. And the mitral in the left intercostal space. Heart sounds are normal with no murmurs or gallops. Can you roll to your left side, Mom? I'm going to check for your mitral stenosis. So I'm going to listen to the left intercostal space with the bell stethoscope. No murmurs heard. Okay. Can you sit up and lean forward? Why don't you just sit up on the bed like this? Come on, sit up on the bed. Yeah, lean forward. Mm-hmm. I'm going to assess for aortic regurgitation. So, can you exhale and briefly hold your breath? And I'll listen to you. at the left fourth intercostal space. No abnormal sounds noted. So I'm going to do the abdominal test and you can lay back down, Mom.
Mm-hmm.
Any abdominal pain or issues?
No.
Urinating fine?
Mhm.
Bowel movements are good? All right, good.
Yes.
I'm not expecting your stomach. No rashes, lesions, scars, or bulges. So I'm going to listen to your stomach with my stethoscope. I'm going to start with the right lower quadrant, then the right upper quadrant, then the left upper quadrant, and the left lower quadrant. Okay. Bowel sounds are present and normal, sound normal. So I'm going to listen to abdominal arteries with the bell of the stethoscope. So the abdominal aorta, which is in the middle of the upper abdomen. So the renal arteries is 3 centimeters above the side of the belly button. Iliac arteries is 3 centimeters below to the side of the belly button. So the femoral arteries is the crease of the upper thigh. I will listen to. Okay. There are no brutes noted. So I'm going to percuss all chords and success for tympani abdominis. Tympani is predominant as expected. So now I'm going to percuss the liver to estimate this band. So I'm going to percuss, the left lower side of the abdomen, work my way up. I'm going to percuss from the top to the bottom until the sound changes. The liver span is about 7 centimeters, which is normal. So I'm going to assess the anterior axillary line on the left side of the abdomen. I'm going to check for an enlarged spleen. Any pain?
No.
No pain noted. And also no dullness, which is normal. I'm gonna palpate abdomen for tenderness. No tenderness noted. So I'm gonna deeply palpate for the liver and kidneys. I'm gonna place my right hand under her right side of her abdomen, at the right costal margin. I'm pressing inward and outward while she takes deep breaths. I feel the liver edge as it descends. I'm going to assess the kidneys. Just sit up, Mom, real quick. You don't have to move your legs over. Just sit up for me. Sit up. Perfect. So I'm going to tap her lower back with my fist. Any tenderness?
No.
No. Okay. So the last one is the special abdominal test. I'm going to start with the McBurney's point. So McBurney's point is between the belly button and the right side of the abdomen. I'm gonna press. Is there any pain?
No.
Okay, no pain. So now I'm gonna do the Rosen sign. I'm gonna do the left lower quadrant of the abdomen and quickly release any pain.
No.
Okay, perfect. And now I'm gonna do the solstice sign. Oh yes, the legs. So, I'm gonna raise your leg and then push it down, please. Any pain?
No.
Okay. So now I'm gonna do the obturator sign. I'm gonna rotate internally. Any pain?
No.
Perfect. So the last thing I'm gonna do is assess for the Murphy sign. I'm gonna palpate your liver on the right side while you take a deep breath. Any pain? No pain. This concludes my assessment. Findings are within normal limits. Thank you.